This is very exciting in terms of even just an example of this methylfolic acid. We know, for example, that certain things can lower methylfolate in the brain, not just even the genetics. We know smoking, excessive alcohol use, poor nutrition, certain medicines, many of the anticonvulsants, but many of those anticonvulsants are things we use to treat, for example, bipolar disorder, may lower brain folic acid level. Some of the medicines people take to treat cholesterol can lower brain methylfolate levels. And so that's another population that as a clinician I may say, boy, here's an individual whose depression looks like it starts to get better, but they just can't get over the hump. Those are individuals, again, to consider, this medical food. We have many effective treatments for major depression. The key is to stay as involved in the treatment as possible. And a very important message I say to every consumer out there is, if you don't feel you are at the optimal level of your functioning, get a second opinion. Stay involved. We've learned from the STAR-D NIH-funded trial that basically over 2/3 of people do not respond to their first treatment intervention. We may have to use combinations of medicines. We may have to use psychotherapeutic interventions. We may have to make lifestyle changes, add things to improve one's quality of life and reduce the stressors. Those are all very important strategies to try to make sure the individual is in remission. Now, our current conventional treatments include a list of antidepressants. We know antidepressants can be effective, but we're learning more and more that for a good number of individuals, it may be needing a combination of more than one treatment or adding a psychotherapeutic or psychotherapy to the antidepressant that will give them their optimal response, or other, I would call them alternative treatments that will allow them to get the response and the remission that every depressed patient should achieve. But it's important for the individual to remain as proactive, family members to remain as proactive to make sure that all of the symptoms are gone and that the individual is functioning again. Again, it's important for the individual, family members, significant others to remain proactive in treatment. Don't be afraid to get second opinions, even third opinions if you feel something could be better.